Welcome to another episode of I
Wonder
Wednesday. Today we're going to be discussing cataracts. Most people think they're a disease, and they truly are not a disease. They're a birthday gift you can't return or give to your Aunt Betty. They are definitely part of life, and if you live long enough, you'll have to have them taken out. There are some things that we do know that make them grow more quickly, so I'll let Dr. Gerstberger talk about that.
Yeah, so in this part of the world, we live in a rural environment. We have lots of farmers and ranchers. Well, most of my farmers and ranchers spend a lot of time outdoors. UV exposure is probably the number one thing that accelerates the growth of cataracts. So if you protect your eyes with glasses or with sunglasses, you're going to get UV protection, and that can slow down the development of those. We have seen a little change, even in the 17 years that I've been practicing, in the rate of development, because all of our vehicles now have UV blocking windshields. My dad grew up driving a cabless tractor and a cabless combine, so didn't wear sunglasses for any of those things. So my farmers and ranchers a lot of times will get cataracts taken out in 50s to 60s, I think, is pretty common. My people that do a lot of welding. Yep. Welding introduces a lot of artificial UV light, and that can cause those cataracts to develop sooner. Glass blowing, again, kind of a recreational thing, but there are a few people that do it professionally. So my welders and my glass blowers a lot of times will get cataracts taken out in, their 40s. Because of the just abnormal amount of light that they're absorbing.
Something kind of interesting about that. My first 3 years of practice, I was in Denver. And the average age of a patient in Denver having cataract surgery is about 5 to 10 years younger than it is here. And that's because of the UV and the ozone layer not being good there. And then also they're a mile high, literally. And so they're closer to the sun. And so when I moved here and started seeing patients here, it was interesting that most of my patients aren't or they're 70, 75 by the time they really need them out, unless they have some extenuating circumstances. The other one, unfortunately, is smoking. Smoking is bad for you altogether, but it will speed up the growth of a cataract, and they tend to have to come out sooner. We still don't know about vaping and what that's going to be like down the road. Unfortunately, when my 80-year-old patients were young, smoking was cool, and so they all did it. Unfortunately now, vaping is something that a lot of younger people do, and I would suspect 20, 30 years from now, we'll find out what that total effect is, kind of like those poor 80-year-olds now that are finding it out. So smoking's the other lifestyle risk factor that you can control that will prevent your cataracts from getting worse faster. And then wearing sunglasses.
Yeah, protecting your eyes from UV, any kind of, extra energy is kind of what will slow down that cataract. We also have congenital cataracts. I've had patients come to me at 3 years of age with a cataract, and the parent didn't know. They just knew that the patient wasn't seeing quite normally. I've had other patients that make it to 20 or 24 before they need cataract surgery from a congenital cataract. We also have traumatic cataracts, eye injuries, impacts, car accidents, airbags. All of those things can cause enough of a trauma to start a cataract, and that may not need to come out right away. You're an example of this. You had a retinal surgery.
Because of an injury I had as a child, yep.
And after retinal surgeries, a lot of times we get...
I have a cataract, yes I do. It needs to come out eventually, but I'm kind of waiting on that just until... cataracts are an interesting thing in that you don't take them out the minute that you have a cataract, because it isn't surgery and because they're opening the eye. We don't do cataract surgery, by the way. We send you to an ophthalmologist for that. When they open the eye, there are risks involved. Any surgery has risks. And so we always wait for the cataract to be bad enough that the risk of surgery is outweighed by the benefit of surgery. So if a patient comes in and we can change their eyeglass prescription and get them back to 20/20, the benefits of cataract surgery are almost none, and the risk is the same. So that means that it's better to change their eyeglasses than it is to recommend cataract surgery. There are a few instances where cataract surgery needs to be recommended sooner based on if the eye, sometimes cataracts can cause the pressure inside of an eye to go higher. And of course that changes the subject. Or even more often, we have patients who will come in about every 6 months and need their eyeglass prescription changed as that cataract is changing rapidly. And after about the second time, it's pretty frustrating for the patient to say, okay, now I have to change my glasses again. It's only been 6 months. And at that point, it's probably worth a referral and probably worth at least figuring out if the cataract has reached the point that insurance will cover the cost of the surgery as well.
Yeah. I think that's an interesting point because cataracts, I've never met a person that made it to 60 years of age without the beginnings of cataracts. And so if you're past 60 and you don't think you have a cataract, you probably do. It's just probably a very mild one, and you're noticing very subtle changes to your vision. You're noticing that you need more light to read with. You're noticing that oncoming headlights have a lot more glare to them, especially those bluish and purplish lights. That cataract scatters that light into the eyeball, and it makes it very difficult for you to see past that glare. So, yeah, there's a lot of times that we can fix some of those symptoms and kind of explain the process or tell you that, hey, you need to bring along a little extra light if you're trying to read a part number or an invoice number in the storeroom. So if you've been told you have a cataract, don't panic. They're part of the birthday process. Everybody gets them. Just let us evaluate them, and we'll work with you to figure out when the right time to have that cataract removed is. Yeah. Thank you for watching. Please like and subscribe. You can find us
Facebook, Instagram, and YouTube.